were diagnosed with multiple sclerosis in 2005. How do you feel treated as an MS patient since then?
In the first time, I felt lousy. I was depressed and angry and all these negative attitudes you can have when you have a diagnosis like MS because you don't know something about it. And mostly people, or I was thinking myself about MS, I will sit in a wheelchair tomorrow. And there was nobody to help me out of this black hole because it was not enough time with the doctors to answer my questions, and also there were not social support available, so I felt alone. I was lonesome in the whole situation.
And now, all of these years later, you've done so many different things, and you do so many different things, and you're on the expert panel for this index. How do you see the index being used to help improve outcomes for patients?
I think the most important point of this whole collection of data in this index can help to come together on one table, patients, also maybe doctors, and also governments and all the other stakeholders, to come together and talk, have a lively discussion and exchange experience and arguments, and to find the conflicts maybe, or also ways to bring up better solutions or in therapy options, whatever.
So how do you feel now about the amount of data that's available around MS today?
I think every single piece of data we have can help to define better services, to make healthcare more personalized, and also to create a better environment around the patient to raise more quality of life, for example, because I think a patient has a right to a good quality of life. And also it's an important point for creating better services in the healthcare systems. It's not only always the patient, it's also the healthcare systems, and also for the doctors and nurses and all the people around.
And perhaps the index can help facilitate that dialogue.
Yeah, the index can create a dialogue and a discussion, and it can encourage people to say what they want and what they need, and also to encourage people who are silent at the moment.
Based on all of your experience, and including what you have been involved with in this index, if you had a magic wand and you could make one wish come true that would make a big difference to the lives of patients with MS in Europe, what would you wish for?
Care. It's very easy. To make a better care means all the things around care are involved. So, and I think this is the big word for a lot of things, and this would be my only wish.
Thank you so much for answering all my questions. A pleasure to meet you.
Pleasure to meet you. Thank you.